Madam President, over 4 months ago, Steward Healthcare and the more than 30 hospitals it owns in 8 states declared bankruptcy with some $9 billion in debt. This bankruptcy has caused devastating harm to patients, healthcare workers, and entire communities from Massachusetts to Arizona. In July, the Senate Health, Education, Labor, and Pensions Committee that I chair voted to authorize a bipartisan investigation into the financial mismanagement of Steward Healthcare. On that same day, the Health Committee also voted to subpoena Dr. Ralph De La Torre, the CEO of Steward Healthcare, to testify at a hearing on this very important issue on September 12th. Sadly, Dr. De La Torre made the unfortunate and unacceptable decision not to show up at this hearing in defiance of a congressional subpoena. So last week, the Health Committee voted 20-0 on 2 resolutions to hold Dr. De La Torre accountable for his failure to appear at this hearing. The first resolution instructs Senate Legal Counsel to bring a civil suit in the District Court for the District of Columbia to require Dr. De La Torre's compliance with the subpoena and his testimony before the Health Committee. The second resolution would refer this matter to the U.S. Attorney for the District of Columbia to criminally prosecute Dr. De La Torre for failing to comply with the subpoena. In a few moments, I will be asking unanimous consent to pass the second resolution, which seeks to hold Dr. De La Torre in criminal contempt for failing to comply with the congressional subpoena. But before I do that, let me take a moment to briefly explain why the Health Committee believed it was so important for Dr. De La Torre to testify before Congress. First, we wanted Dr. De La Torre to explain to us how it could happen that at least 15 patients at hospitals owned by his company died as a result of a lack of medical equipment or staffing shortages, and why at least 2,000 other patients were put in immediate peril, according to federal regulators. That is something that the American people deserve to know. But perhaps most importantly, we wanted to know how it could happen that while thousands of patients and healthcare workers suffered and communities around the country have been devastated as a result of Steward Healthcare's financial mismanagement, Dr. De La Torre and the companies he owned were able to receive at least $250 million in total compensation over the past 4 years. For months, Senator Cassidy, the ranking member of the Health Committee, Senator Markey, the chair of our Healthcare Subcommittee, and I have asked Dr. De La Torre to testify before our committee to answer these questions. And time after time, he has arrogantly refused. And that is simply not acceptable. So today, I will ask the Senate to unanimously adopt this resolution seeking to hold Dr. De La Torre in contempt of Congress. Let me take this opportunity to thank Ranking Member Cassidy and his staff for working with me and my staff on this very important issue. The passage of this resolution by the full Senate will make clear that even though Dr. De La Torre may be worth hundreds of millions of dollars, even though he may be able to buy fancy yachts and private jets and luxurious accommodations throughout the world, even though he may be able to afford some of the most expensive lawyers in America, no, Dr. De La Torre is not above the law. If you defy a congressional subpoena, you will be held accountable no matter who you are or how well connected you may be. The goal of the Help Committee throughout this entire process has been to make sure not only that we have a complete understanding of the financial chicanery surrounding Steward Healthcare, but to do everything that we can to make sure that such a travesty never occurs again. Madam President, I ask unanimous consent that 2 letters be printed in the congressional record, one from Dr. Delatorre's attorneys to the committee, and secondly, a response letter from Ranking Member Cassidy and myself. And with that,
without objection.
Madam President, I would be happy to yield to the ranking member of the committee who has done an excellent job on this issue, Senator Cassidy.
Thank you, Mr. Chairman. Madam President. Madam President, for months, the Help Committee on a bipartisan basis has investigated the financial mismanagement of Steward Healthcare and the impact on the delivery of care at its hospitals. Steward's mismanagement has nationwide implications affecting patient care in more than 30 hospitals across 8 states, including one in my home state, Glenwood Regional Medical Center in West Monroe, Louisiana. Because of Steward's management decisions resulting in limited resources at Glenwood, the state had to force the hospital to operate at 1/3 capacity. One patient reportedly died waiting for transfer to another hospital because Glenwood did not have the necessary resources to treat. According to a report from the Centers for Medicare and Medicaid Services, a doctor at Glenwood told a Louisiana state inspector that the hospital was, quote, was performing, quote, third world medicine, end quote. Now, the problems at Glenwood are not unique. The Help Committee heard testimony that because of understaffing at a Steward-owned St. Elizabeth's Medical Center in Boston, patients at the hospital waited in the emergency room for hours and sometimes days. We've also heard testimony that Steward neglected to pay the vendors for essential hospital services. At St. Elizabeth's, there's a report that when newborn babies died, nurses had to put their bodies into cardboard shipping boxes because Steward did not pay for proper bereavement boxes. A new mother who experienced a hemorrhage or a bleed during childbirth died because a basic piece of medical equipment required to save her life to stop the bleeding had been repossessed because Steward did not pay its bills. Through the committee's investigation, it became evident that a thorough review of Chief Executive Officer Dr. Ralph Delatorre's management decisions was essential to understand Steward's financial problems and its failure to serve its patients. To better understand and hopefully prevent this from happening again, we sought testimony from Dr. Delatorre. Frankly, given him the opportunity to present his side. It's possible that there's something we didn't understand, and if he presented it, that understanding would have given us a different perspective. Unfortunately, Dr. Delatorre refused to testify voluntarily. As a result, the committee issued a subpoena in July, and up until September the 4th, his lawyers indicated he intended to comply with the subpoena and to testify. However, 8 days before the scheduled hearing, Dr. Delatorre informed the committee he would not comply with the subpoena. We responded to Dr. Delatorre explaining why his objections to the committee's subpoena had no merit, directing him to comply. Unfortunately, Dr. Delatorre ultimately defied the subpoena, refusing to appear before the committee. Now, a witness cannot disregard and evade a duly authorized subpoena. That is why today the Senate will be voting on a resolution to hold Dr. Delatorre in criminal contempt for defying the subpoena. I think it's unfortunate that we are here. But if someone shows contempt for the American people by defying a subpoena and refusing to provide answers, that is a contemptible thing. Congress has a responsibility to act. I urge my colleagues to approve this resolution and to hold Dr. Delatorre in contempt. And with that, I yield to my colleague.
Cassidy, Senator Markey has played a leadership role in the investigation and this whole process. I'd like to yield to Senator Markey.
Thank you,
Thank you, Mr. Chairman, very much. Thank you for your great leadership on this issue. Thanks to Senator Cassidy. We've made this bipartisan from the very beginning in order to ensure that the American public can completely understand what has happened to this Steward Healthcare chain. And I thank them for their leadership in holding Dr. Ralph DeLatorre accountable for his greed and shining a light on the deadly consequences that result from the involvement of for-profit forces in our healthcare system. Steward Healthcare declared bankruptcy in May. It was the culmination of a financial tragedy. Over the past decade, Steward, led by its founder and CEO, Dr. Ralph DeLatorre, and his corporate enablers, looted hospitals across the country for their own profit. And while they got rich, workers, patients, and communities suffered. Nurses paid out of pocket for cardboard bereavement boxes for the babies to help grieving parents who had just lost a newborn. Hospital beds collapsed underneath patients. Patients died alone in hallways. The Boston Globe Spotlight team has laid out the details in eye-watering fashion. Meanwhile, Ralph DeLatorre and his corporate cronies got just what they wanted: hundreds of millions of dollars in profit, yachts, private jets, luxury vacations. They used hospitals to fund their own episode of Lifestyles of the Rich and Famous. And its star is CEO Dr. Ralph DeLatorre. Today we are here because Dr. DeLatorre has yet to answer for what he has perpetrated. I asked him to appear before my primary health and retirement subcommittee in April in Boston. He declined. He refused. Senators Sanders and Cassidy invited Dr. DeLatorre to testify in July here in Washington. He declined. He refused. On July 25th, the committee issued a legal order for him to appear. He ignored it. He refused. Dr. DeLatorre is using his blood-soaked gains to hide behind corporate lawyers instead of responding to the United States Senate's demand for actions. But while he tries to run and hide, Dr. DeLatorre is revealing himself for what he truly is: a physician who placed personal gain over his duty to do no harm. The Senate has not made a criminal contempt referral in more than 50 years, since 1971. It is a rare move for the rare degree of callousness, cruelty, and cowardliness that Dr. DeLatorre has demonstrated. In the face of all of the mismanagement, health workers fulfill their sacred responsibility to their patients and to their communities. They cared for young and old, held grieving families' hands, and responded in people's greatest moments of fear and vulnerability. And now, workers and communities will spend years cleaning up Ralph DeLatorre's disaster, all in order to ensure that they will be protecting patient care. The rich don't need to use communities as a safety net for their wealth, but that's how Dr. DeLatorre used these hospitals and communities, including in Massachusetts, and sacrificed community health in the process. They are rightly outraged in those communities, and I am outraged for them. For them and for everyone who has suffered due to Ralph DeLatorre's greed and Steward's collapse, I hope the Department of Justice will move swiftly to bring charges against him. To Dr. DeLatorre, you cannot use your millions to shield yourself from accountability to the American people. I urge the Senate to hold Dr. Ralph DeLatorre, CEO of Steward, in criminal contempt. And I thank, again, Chairman Sanders and Ranking Member Cassidy for their great leadership on this issue.
Senator Markey, thank you for your leadership role on this. Madam President, as if in legislative session, I ask unanimous consent that the Senate proceed to the immediate consideration of calendar number 522, Senate Resolution 837.
The clerk will report.
Calendar number 522, S-Res 837, authorizing the President of the Senate to certify the report of the Committee on Health, Education, Labor, and Pensions of the Senate regarding the refusal of Dr. Ralph de la Torre to appear and testify before the committee.
I know of no further debate on the resolution.
Without objection, the Senate will proceed to the measure.
I ask unanimous consent that the preamble be agreed to and the motions to
Senator from Vermont, could you if there is no further debate, all those in favor, please say aye.
Aye.
Those opposed, no. The ayes appear to have it. The ayes do have it. The resolution is agreed to.
Madam President, I ask unanimous consent that the preamble be agreed to and the motions to reconsider be considered made and laid upon the table with no intervening action or debate.
Without objection, so ordered.